A happy morning to all of our distinguished guests and viewers who are watching our press conference via Zoom and the Department of Health Philippines Facebook and YouTube pages. We are live. My name is Dr. Albert Francis Edgerlin Domingo, Assistant Secretary of the Department of Health Philippines, and it is my honor to moderate this press conference for the high-level meeting on tuberculosis here at Sofitel Philippine Plaza, Manila. Before we officially start our press conference, allow me to acknowledge our panelists joining us here in front, starting with Stop TV Partnership Executive Director, Dr. Luchica Ditiu. Good morning, Dr. Ditiu. Round of applause, please. Of course, our very own Secretary of Health of the Philippines, Honorable Teodoro J. Orbosa. Good morning, sir. We have with us Undersecretary of State from the Ministry of Health in Cambodia, Honorable Mao Tan Liang. Good morning, sir. We have Deputy Minister of Health from the Lao People's Democratic Republic, Honorable Tevan Kyo Prasut. Good morning, sir. And from the Ministry of Health Japan, Labor and Ministry of Health, Labor and Welfare of Japan, Assistant Minister for Global Health and Welfare, Honorable A.G. Hinoshita. Good morning, sir. And to the rest of our distinguished guests from different countries, partner agencies, as well as our international and local journalists and friends, a healthy morning to all of you. The Department of Health Philippines, in collaboration with the Stop TB Partnership and the United States Agency for International Development, is hosting a regional high-level meeting from March 14 to 15 this year to address the global tuberculosis crisis and to target actions, resource mobilization, and advocacy efforts to effectively combat TB on a global, regional, and national scale. We are having this press conference to answer the questions of our international and local journalists regarding the ongoing regional high-level meeting so that we can hear from the expertise and insights of different countries about collaborative efforts to address the global tuberculosis crisis. To start, may I invite the Philippine Secretary of Health, Dr. Teodoro J. Orbosa, for opening remarks. Over to you, sir.
Thank you, Asik Albert, and to all our media friends and all those tuning in via digital platforms, Zoom, Facebook, YouTube, and all the different pages. Welcome to today's Media Forum. A good day to all of you. We appreciate your presence in this press conference, which is focused on our efforts to combat tuberculosis. And it's a partnership, it's a global partnership called Stop TB Partnership. And this is actually the first dialogue that's happening after the UN high-level meeting in September last year, which actually focused on tuberculosis as well, with about 140 ministers of health attending that meeting. As Secretary of Health of the Philippines, it is a privilege to be part of this gathering and hosting this event for Stop TB Partnership. And we are joined by esteemed health ministers and deputy ministers and leaders from the different countries. Here with me today is actually the Minister of Indonesia had a meeting with WHO, so he couldn't join our press conference. But our deputy ministers from Lao PDR, Cambodia, along with the Executive Director, Japan also, along with our Executive Director, my sister, Luchica Ditiu, who's been pushing for ending TB in the world. Tuberculosis has remained a global public health challenge since its discovery. We come together today as partners in the fight against tuberculosis, united to ending this epidemic. We recognize that TB is not only a health issue, but also a social, cultural, economic problem, affecting the more marginalized populations in low resource settings. In our respective countries, we have made progress in TB control and management. Nonetheless, significant work lies ahead it is imperative that we intensify our endeavors to guarantee equitable access to tuberculosis care and support and other services. Furthermore, I would like to extend my gratitude to SD Biosensor over there from South Korea for their generous donation of standard M10 point-of-care molecular and diagnostic assay for a total of 8 consoles and 30 modules. The standard M10 is an innovative diagnostic solution offering simplicity and speed and will revolutionize the diagnostic process. It is a molecular testing, which is now the standard of care for tuberculosis and drug-resistant tuberculosis. This will help the country's objective to eradicate tuberculosis through early and quick screening. I'd like to again express our gratitude to our esteemed partners from Stop TB Partnership for collaborating with us in organizing this significant event, and we are delighted to have the first regional dialogue held in the Philippines. Together, we reaffirm our commitment to working together and harnessing our collaborative efforts and the resources and expertise so that we can achieve our shared goal for a world free from tuberculosis. Because, yes, we can end TB. Thank you.
Thank you so much, Secretary Robota. Yes, we can end TB. And yes, we are now moving on to our question and answer forum. Before anything else, we would like to remind our friends from the media that advanced or submitted questions will be addressed first, followed by our live questions. So I would like to call in order our media partners who are present. When I call your name, you can please approach the microphone and ask your question. First up would be Dexter Cabalza from the Philippine Daily Inquirer.
Good morning po. This is for Secretary Herbosa. It's been exactly a year since we launched the Philippine Acceleration Action Plan for the 2023-2035. Where are we on it, and in which aspects are we having significant progress, and in which aspects are we facing challenges?
Thank you for that question. The PAAP, or the Philippine Acceleration Action Plan for Tuberculosis, is a multi-sectoral action plan that details other government agencies, including the private sector. I just saw walk in the people from the Philippine Coalition Against Tuberculosis, led by Dr. Camila Roa and its president. They're actually always been our partner for many years, helping us fight against tuberculosis. But this accelerated action plan asks different government agencies, like the Department of Labor, who issued Labor Advisory Number 21, Series 2023, which are the guidelines for the implementation for safety and health measures in the prevention and control of tuberculosis in the workplace. These are for employees diagnosed with TB, especially throughout the 14-day infectious phase during their treatment process. Employers are encouraged to provide the following arrangements. For employees, there are a paid leave benefit on top of the existing leave benefits. Is on top of in this company policy, and it's a part of the collective bargaining agreement with the labor unions, the labor code, and special laws. Flexible arrangements, rescheduling their work hours, and adoption of other work arrangements, including telecommuting and other benefits. The other agencies, the Department of Social Welfare and Development, they referred 294 presumptive TB clients for screening and case management, and 86 treatments were actually instituted for this particular effort. The FDA also approved the registry of the ultra portable X-ray for TB diagnosis, which is before the FDA didn't want to allow mobile and portable X-rays locally because of the danger of radiation exposure. But after careful study, they have actually approved it for TB diagnosis. PhilHealth, on the other hand, has released the implementing guidelines for Consulta SDG with related benefit package. And then the Department of Health, of course, we have our program for tuberculosis, and also the shorter treatment regimens have been launched last year for drug susceptible TB. And then we have the TB patient support groups, very important partners. I've actually met with them a few months ago, and there is a lot. They're addressing many gaps that the government agencies are unable to address, especially on the social side. And then there's also TESDA that's provided support for the initial stage of the development of competency standards for community navigators for improving our TB plan. So we have a comms plan to localize the plan in the different LGUs is in the pipeline, and we will further operationalize the Philippine Accelerated Action Plan for tuberculosis in the different regions.
Next, sir, did you have a follow-up question?
Yes. This is for Secretary Boss again, and maybe the other health ministers can also comment on this question. Secretary Boss earlier raised the shortage of TB medications, especially in TB dot centers worldwide, in the country. And this is also a problem being faced by other countries worldwide. How are we addressing this shortage of TB medications? And for Secretary Boss lang, ano po yung follow-up dun sa commitment po with the local pharma companies of producing anti-TB medicines?
Okay, actually it's a problem of logistics management. We buy enough TB meds, but unfortunately they are sent to hubs in our regional offices. But to be able to deliver them to the specific TB centers in the different regions, that's where I think the delay and the obstacles are. We really need to copy our colleagues in the online selling industry. They're able to do this better, much better. So I've met with logistics expert on how to make sure that every time you enter a TB center, the drugs are available. I told my ex-ecom, I go anywhere in the country. I go to a sari-sari store and I will find cigarettes, beer, and soft drinks. How can they do that? In the farthest islands of the Philippines, it's available. But for us, you're a TB positive patient, and then you go to the TB center and they tell you to come back because the medicines are not yet delivered. So we're doing something wrong. The soft drink company and the cigarette company and the beer companies are doing something right. So maybe they should teach us how to get the drugs to our patients. On the other question, I forgot the second question. What was your second question? How am I catching up with
Local companies.
the local company? Yes, we've now met with the president because the president also wants TB drugs to be all medicines to become cheaper. But the offer for the TB drugs was actually there even last year. So now the development here is the president appointed Secretary Frederick Go in the development of what we call the pharma zones in our PESA. So our Philippine Economic Zone Authorities, where they're inviting investors to actually manufacture there. With my discussions for the pharma company, they're willing to manufacture as long as we will procure it. Of course, we will do that because we have TB patients actually supply. So it will be part of our logistics pool of medicines, what they manufacture. The beauty of that is it will provide jobs, it will provide access, and as you know, there's difficulties in local supply chains. Sometimes you order the drugs, but they do not arrive in the Philippines in time. So manufacturing in here would help not only the Philippines because it's a export zone authority, it will also help my neighboring countries, Indonesia, Vietnam, and everywhere else, where the drugs can be shipped straight from the economic zone. Thank you. The other colleagues can talk about how they manage drug supply in their country.
Thank you, Secretary Robosa. Would our senior colleagues from Cambodia, Laos, or Japan have comments on the TB medication supply chain, sir? Assistant Minister Eiji Hinashida from Japan.
Regarding the MDL TB, the also pharmaceutical companies have been providing MDL drugs, but currently the prices we are now discussing we are now discussing about how we can manage, control the prices of the drugs to in order to promote the access to the patient who need that drugs, those drugs.
Thank you so much. We can move on to other questions or to our ministers from Cambodia now. The contributions to the discussion go on the supply of TB medication. Thank you, sir. Go ahead.
Thank you very much. So for me, I just want to share about medicine or drug for TB treatments. For the price, so if we are compared with another country, especially for the low middle income, so maybe we have to concentrate because now in our country we have to go financing with like a drug or medicine for tuberculosis treatment. But in the real situation, not only like a TB medicine, but we have to combine with another like symptoms of medicine. We have to. So I think it is very important. So in the future, we should talk together in order to make the people who get like a tuberculosis infection can access to the treatment, like a quality of treatment.
Thanks so much, Undersecretary.
This year to share my own experience in terms of supply chain management, especially ensuring that there's a low reduction of the drug application. For your mention, I had been an manager of Cambodia for 20 years, between 2001 to 2020. I just take you only to share a kind of practical experience in terms of this ensuring and the rapid supply. So at national level, in our SOP policy, we have the so-called buffer stock at the national level. And my time is 9-month buffer stock. And then 3-month buffer stock at the district level. So whenever we face a buffer stock below this threshold, then we need to do some action. But if in some case, during my 20-year experience, sometimes buffer stock national below 7 months or 6 months. This is there should be a big alert, whereby the supply, the incoming that should be by fast track, by air, particularly. But if around 9 months or something, so this is to be brief. Every day I was thinking on drug, where's my drug? Whether not my patient lung or something. And I think those day my 3 day of management, I mainly rely on the TDF partnership at that time with supply. Even when we transition from donor partner funding supply or drug to government, then we have very clear and very rigorous thought out plan in terms of transitioning from partner drug, donor drug, especially for land drug to government drug. So we create drug from government from, I still remember 5-year transition. Year 1, we received 20% financing from government, then year 2, 40, and then up to I think about 10 years ago, we started financing for land drug from the government. So this is we just show you our own experience, maybe because expecting different but for my experience, then we need to be on that. And to the facility level, to finish my talk, we need at least 1 month buffer stock at facility level. When I say facility level, it's health center level, Because health centers are the most peripheral health city in our country. This not include even community because we rely on community dot or stop or just to deliver to even keep drug for our patient in a secure box or something both in of the front line drug and thank you.
Thank you so much, Minister. Our next question comes from Ms. Patricia Lopez of IPC 13. Ms. Lopez, please go ahead with your question.
Secretary Proposal, ano po yung data ng cases natin ng tuberculosis dito sa Philippines? Tapos, marami na po bang, so far po ba, ilan na po tayo nito? And yung chances na maka-recover or ma-cure?
Thank you. I'll answer you in English so the international media can understand. So she was asking me about our statistics on tuberculosis. And I read in my speech that for a period of 5 years, we actually identified about 2.1 million cases, short of our target of 2.4, 2.5. As of December 31, 2023, our new cases numbered 612,534. So if you divided 2.1 million divided by 5, that's be about 400,000 a year. But in 2023, we reported 612,000. So that's about 549 cases per 100,000 population. That's higher than the 2022. So we had an increase in 2023. The previous was only 439 per 100,000 in the previous. So these are the new cases. So 86% of those new cases were diagnosed with the new molecular testing tools, new diagnostic tools. And some also that we didn't include were from the private sector, because the private sector is not mandated to actually report, but we do hope that eventually we can include this data as well. As for the deaths, I can only give you data from the IT system of our TB, the IT TB register. It's called ITIS, information technology system for TB. And what happened there is people are reported as dead. That doesn't mean they died from TB. So from the 2022 cohort, the 2022, the 459, which is the 22 diagnosis for the 400,000 plus. The cohort deaths, those that there were about 10,000 cases that were identified as outcome died. But that doesn't mean they directly died of TB. They could have died of other causes other than that. So hopefully we can have more data. When I put TB as my number 4 in my outcomes, I said I wanted 0 deaths. And then the TB specialist came to me and said, no, you can't do that because TB meningitis has a 50% mortality. So we changed it. So now we've agreed it will be 0 deaths from pulmonary tuberculosis. So if we diagnose TB, pulmonary TB, and we're able to put them on treatment, they shouldn't die. Correct, Dr. Roa? Yeah, he agreed. So that's the secretary about coercing the private sector. So the data source is the integrated tuberculosis information system. So we have an IT registry for TB. Thank you.
Thanks so much, Secretary. Patricia, follow up.
Since March 24 is the World Tuberculosis Day, do we have a it now?
Team.
Ano po ba tayong
Team. World Tuberculosis Day, the team.
Yes, we can end TB. That's the motto. Yes, we can
Ano po mga
end TB. For your information, I also like to announce that on Saturday, we will be attempting to break the world record of largest human formation of the lungs. And this is our advocacy and I'm inviting you all to join so you can be part of the world record. So you join, we're expecting about 8,000 people to actually do a formation of the lung at the Quirino Grandstand. I think this will be at 6 a.m. So we do hope the media can also come and join us in our attempt to break the world record. I think this will be our, if we succeed, this is going to be our second world record, Guinness record. The first one was the biggest number of Zumba dancers. I don't know what year that was or which health secretary that was, but this is the second attempt. The previous record is held by India. It's about 5,000 people. So I already have registered 8,000. So please pray they all come on Saturday and join me. If they don't come, join me and we'll do break the Guinness record.
Thank you, Secretary. So on Saturday, laman lang. Yes. Right. We have here a few questions submitted. Can you elaborate on the key objectives and strategies of the joint initiative between, I think this is for Dr. Luchita. Can you elaborate on the key objectives and strategies of the joint initiative between the DOH and the Stop TB partnership, and how these efforts aim to contribute to the overall goal of eradicating tuberculosis? Dr. Luchita.
Yeah, so thank you, and I'm very happy to be here, and I'm very happy to see all of you here. And this is how I always start in my interactions with media. I'm very pleased for those of you writing about tuberculosis. The more you write, the better it will be. And to be honest, I don't care what you write. Write about TB, because you need to sell your news, you need to sell your newspapers. Bad news sell better. Scandals sell better. We want people to know about TB, because in all the world, and in high burden countries as well as in low burden countries, people don't know that TB is with us. And as the minister said, and you will hear from us, we have tuberculosis with us for thousands of years. Our grandparents, great-grandparents suffered and died of TB. It's a shame if we leave this to our children. It's an airborne disease. It's spread through air. It's like a COVID, but it didn't get so far the attention of COVID. And the Minister Herbosa in the opening made a very good speech, as well as the Minister of Indonesia, about why in the world a bug like tuberculosis, which is airborne, is not getting the same type of attention as COVID. But we are all at risk. It doesn't matter color, religion, rich, poor. We are all at risk. So from the Stop TB partnership, we are huge advocates, but we also are providing funds to countries to support efforts. We are not a huge funder, but we give funds that are able to develop things and to bring innovations, like the spark, and then the fire can start. We are very happy to be here because we chose to come to Manila and Philippines because we all in the TB space are extremely impressed, and we really, if I use the right word, I say we feel full of admiration over the team in Philippines and you, Minister Herbosa. We didn't meet the minister till September in New York when we had the UN high-level meeting on TB, and we were very impressed. In this world, it's very difficult to find honest people. It is very difficult to find political leaders, not only honest, but that care for their people. Very difficult. Everyone is running for a job, for a better salary, to be that and this. Very genuine caring for your citizen is rare in leaders. They will say some words, just lip service. Minister Herbosa is between the few ministers of health that at least we know, or I know, that care for the people of Philippines. Genuinely, and thank you very much for that. And in there are the people with tuberculosis. So we chose Manila as the first of the regional meetings that we will have. We will go in every region this year to try to bring awareness on tuberculosis, to try to raise the point that it's possible to end TB. We need political leadership and resources, and also to discuss about these targets that we have about the UN high-level meeting that we all need to reach. We are in a partnership with Department of Health, with PhilCat, and our colleagues here in the Philippines, including NGOs and civil society, for some time, and we will continue. Not only in Philippines, because to be honest, if the movement starts, when you do a snowball, it's difficult to make the snow stick together. Maybe you don't have too much snow here in Philippines, so I chose the wrong example. We have a lot of Europe. Yeah, it's difficult when you start creating something till the beginning starts, and then when it starts rolling, you just need to push it, and then it's happening. But we want to show the leadership in the region and to have as well. That's why we have here with us Cambodia, and we have here with us Laos for the efforts that are happening in there ending TB. So you said what we want to do in this partnership. We want to continue till we end TB, because yes, we know we can end TB, but we can end TB if everybody, including everyone in this room, will do their little bit. We have a role, the ministers have a role, the innovators in the private sector have a role, and media and celebrities and influencers, you all have a role. in spreading the word and making the noise bigger. So thank you very much.
Thanks so much, Dr. Luchica. Yes, I was looking at our ministers and it's like Japan was the only one reacting for the snowball. But we were trying to figure out, but yes, but about innovation, all the countries here have innovations. And maybe we can ask questions from Secretary Orbosa and also our ministers. What role does innovation play in the joint efforts to combat TB? And are there any new technologies or approaches being introduced to improve the effectiveness of the campaign? We can start with Secretary Orbosa. Any innovations in TB?
Yes, there's a lot. No, it's an old disease, but we now have newer technologies to diagnose it. So before we used to diagnose it with an acid-fast bacilli. Now we do molecular testing. Right there, you can see an example of one of the models. We were using the Gene Expert with the cartridges, which is a cartridge-based testing. Now we have SD Biosensor. They're donating, the Korean innovation company is donating to us to have increase our testing. There's also TrueNAT. I think TrueNAT is the other one. This is called all in the category of what we call molecular testing. If you remember PCR of COVID-19, how we diagnose, that's molecular testing. So we're now going to use molecular testing. The other one we use for screening active cases is ultra portable X-ray with artificial intelligence. So we go to remote areas, carry an X-ray in a backpack about the size of the camera here, taking photos and videos. We actually have one in the South parking lot, and we invite everyone. Baka yung mga cameraman, gusto nyo magpa-X-ray. Libre po, we will take your X-ray. We're not kidding. I will have my X-ray done. I'm inviting you to have that. I'll have a chest X-ray done. I have Camila Roa to interpret the X-ray for me, one of the top pulmonary physicians in the country. And then we invite everyone to get the seat. So that's the other one. And then the newer drugs. There are newer drugs, shorter therapy. We've started a short-term 4 months only, but there are newer in the pipeline. I even heard of implantable devices that can actually emit the anti-TB, and you don't have to keep coming back to the center. And of course, the one Minister Budi really wants to happen is the new TB vaccines, which is that should be out in market by 2028. He's really pushing for that. The current trials, there are about 4 in the pipeline, having current clinical trials, phase 3 trials, and hopefully if those are successful, just like COVID, we will have by 2028 vaccination for all these people. Then there's other TB prevention. So there's a lot of technology now being used. So I really think we can end TB. Thank you. Maybe they want to.
Thank you, Secretary. And as we pass over to our colleagues from our other countries, if we may invite Undersecretary Mao Tan-Yang, in addition to innovations, could you also provide us some insights? We're curious to find out about the current status of tuberculosis in Cambodia. And can you highlight any notable achievements or challenges faced by your government in the implementation of the Stop TB campaign? Undersecretary.
Sure, before I address your question, and why let me continue and support
Yes,
our Turkey state in terms of innovation. So I want to say something. To me, I think I have 4 small points in terms of the innovation. Innovation very popular, but we need to be careful in terms of innovating. To me, I think innovation should be to find another thing I mentioned by our Honorable Secretary of State. So innovation on technology. In terms of this, I think we should be this innovation should be diverse. For some people, when they say innovation, they just rely on single innovation, single technical platform. But in this regard, innovation should be multiple or diverse. I think I could be straight with this, but innovation should be also on human, on man. Man should be continually innovative. If you are not innovative yourself, then the new innovative technology is that you will sleep. In a simple term. So you need to be continually innovative yourself. I'm not sure whether I'm you the right word or something, but for men, you need to be innovative yourself also. Also, you need to be innovative in terms of your procedure alternative. Like in terms of TV program, we have algorithm for case finding, for case screening, for treatment. We need to be more innovative on that. I might not use the robot. So this is my innovation to my personal use. On the situation of TV in Cambodia, we just transitioning out of the high TV country after 20 years of very intensive, very steady combating the disease. So we are allowed to be transitioning out from the high burden in 2021. As I was manager. So although we are out of the high burden and we are in the so-called watch list, three countries on watch list. So we need to be careful, and as although we are small in terms of population, 17 million, but in terms of number of cases, we have quite a good number. Like last year, we identified 32,000. So in other words, we are having some contribution to the global fund. And if we and I'm not sure Lucica is here, we show colleagues maybe around, but just getting out of the list could be the fact that for me I feel like, oh, my hand here has two legs on it. One leg maybe in the high burden and the other leg is still outside. So or in other words, I could be a neighboring country to high burden country. I don't know how to say, but we still need to be accountable or responsible or shareable to the global package. Situation, yes, there are problems during COVID in 2020, whereby the case detection dropped by around 22%, similar to the global figure. That rate also increased a little bit. But in 2022-2023, we saw a increase of the case detection of around 30%, 33%, the good news, something like that. So we feel that if we were to reach our target set in our site plan of NTV 2021-2030, we have to do more effort, more acceleration. We need more support. We need support from everybody, partner, national support. So everybody, like mentioned by Luca, mentioned by our esteemed panelists and also the speaker this morning, that we need a more effort. And I could say double or triple or even quadruple effort. That's why I support that we need to be bringing more awareness to everybody on the fact that TB still prompted even much more benefit than before. For example, before we used to be below the 8 death higher than TB. We used to be below the malaria, but death to TB is now even more, and quite recently death due to TB is lower than COVID. But now I don't know, please check. Could be death to TB maybe more than the COVID. So in this regard, yes, for the country, we need to do more, and we need to be responsible, accountable to our job, shareable job in terms of the global fund against TB. And if we, I would say, we release our gearing or whatever, then that will be fallen back to the high burden country, and then it depends on Lucica or the director of government or the global to decide. But we are still putting in the watch list country of 3 or 5 years, 2021, 2025. If we, I would say, diminish our effort or something, then the problem. So I think community people more we have a challenge against I challenge just one program. You lack some not my problem. We have it so easy in or more than
Thank you, Undersecretary. And on that note, moving from drugs, there's another thing that we also would like to hear about. Maybe our minister from Lao PDR, Doctor, if you could tell us, in your country, Dr. Favan Kopasut, how are you engaging with for the Stop TB campaign, and what to stigma associated with tuberculosis?
So thank you very much for your question. So now I think TB infection is really important in India because in Laos we have 7.5 population, but the number of TB cases is about 8,000. So for this reason, we have to do everything to control or to end TB by 2030. So as we know, TB can spread by airborne. So to prevention, I think we have to two ways. The first, education. The second, vaccination for immunization. But however, for NTB in Laos, we have a strategy, okay, and also the guideline. So the first, we are supporting on promising in implementation high impact intervention to reach the unreached by all missing TB cases. And the second, encouraging on promising to outreach active case finding of TB among vulnerable population and including person who live in contact. Isolation, active minority, and also prison. Closely with security. And the other, to stop NTB, so it is better, we should have increasing check of tuberculosis preventive treatment with treatment. Because now many people don't like to take a long time of disease. So I think it's better if you have new intervention like a short-term of treatment of TB. And the other thing, the important that the further support PHC at IC level beyond at community level. For the best practicing, I think it's better if we can sharing the best practice and lesson learned from our TB control, we can exchange experience how to control TB.
Doctor, with the indulgence of the panel, we've been hearing from Cambodia and Laos, and perhaps we will ask that next. Dr. A.G. Hinoshita, our Assistant Minister for Global Health and Welfare. Some decades ago, tuberculosis was a big problem in Japan, but Japan prioritized and quickly brought it down, the rates of TB in the country. What lessons could you share with all of us here on what high TB burden countries can do?
Thank you for your question. As I mentioned, TB was a major leading cause of death in Japan in 1930s and 1940s. The most important thing is how we can make a strong political will, because we started our countermeasure by establishing the TB TB Prevention Act in 1951. After that, we started the various measures such as registering, testing, treatment. But at the time, there is a low quality, and it was not a good weapon to fight against TB. But now we have a new innovation to fight against TB. So in 2021, Japan became a low prevalence country, but it will take 7 years from our countermeasure to be achieved the low prevalence country. But new innovation can have a possibility to shorten the period of that time. So we expect that new innovation will accelerate to achieve our goals.
Thanks so much, Dr. Hinoshita. Actually, what the good doctor is saying is it took them 70 years and a strong political will, but because of innovations, maybe it can take us a shorter time. We do have a few more minutes, just quickly, because we have follow-up questions. I'd like to call on Mads Villar from Net25. If you can please ask your question.
The question is for Secretary Barbosa. So in Philippines is among the top 10 countries with the highest TB cases last year. Where are we now, po? And earlier you said that we can end tuberculosis here in the Philippines. When is the target of the government for the country to be declared TB-free?
We're trying to align with the global, that's the NTP in 2030, but the Philippines is endemic. We get about 600,000 cases a year, new cases a year. So the idea is to be able to make sure that 100% of those that have TB are diagnosed. So the first important aspect is making sure that if you have symptoms, you're able to get the X-ray and get the molecular confirmation. The second stuff is that at least 99% of those that get diagnosed get the medications. So that's the important part. So we're making sure that the medications are always given and provided. So it's right addressing the problem of stock outs of the TB meds in the different TB centers. And the third really option is really TB prevention, maybe through the TB vaccine, if the vaccine comes out effective, or in TB treatment of all those that are exposed in the same household. So this is the way we'll fight TB. It's very similar to how we fought COVID, because COVID is therefore prevent, detect, isolate, treat, and reintegrate. That was our strategy before so I won't be doing anything new, but I'll be using the newer technologies that will help us actually pick up the cases and then treat them. And I said, my target is not eliminating TB because that's impossible during my term up to 2028, but I'm going to make sure that every person with pulmonary TB gets the medicine and do not die from tuberculosis. Thank you.
Thanks so much, Secretary Barbosa. And then we have Joel Kalakay from PTV4. Noel is behind the camera, so they're over there.
Hi, sir. So programs and all your plans to fight against TB. So right now, we have stigma. How you can deal with it, and what are your approach in order to stop this stigma? Because might be the reason why there are TB patients who are afraid to come out and have a medication. You can answer it.
That's correct. One of our bigger problems with why TB has become a crucial issue is that it is a disease that people are afraid of or they hide it. So we have a lot of latent TB. It means people know they have TB, but they don't go for treatment and they disappear from treatment because they are embarrassed. Even our own TB patients, I discovered, do not go to the TB center in their own barangay. They go to a barangay where nobody knows them, right? Because of chismis, rumor. So maybe this is where you can help me. This is about information. This is about risk communication. The stigma is only because they think TB is like leprosy or some other disease that's scary. We need to give that information out to the people. The TB is, we can diagnose it and we can cure it. And that's the most important part. And that if you have a family member or loved one with TB, you could be able to prevent from him infecting others. So if we're able to get this out, that's why we have this press conference. I'm hoping that all of you will write about the better stories that I give you, that we can cure TB and we can end TB rather than the stock outs and the stigma. But information is the answer to stigma. People get educated, people have the information about what tuberculosis is, where to get the X-ray, where to get the medications, then we can stop the stigma as well. So thank you for your articles in advance.
Dr. Lichita, would you like to add?
Yes, thank you so much. And just to add what the minister very well articulated, it is stigma everywhere. And it, as you said, it impacts heavily the TB outcomes, not just in Philippines. There are places, I was saying yesterday too, sometimes in which women cannot marry if they have TB. And including in my own country, it's not it's not how to say a given, but if people find out a young lady had TB, her chances to get married are very reduced. Okay, so there is huge stigma. It comes. So how do we work against that? You know, even the fact that we have the ministers speaking about it, it helps. people that had TB and got cured, it helps. There is a Brazilian football player called Thiago Silva, who is now playing for Chelsea, but he used to be the captain for a long time for Paris Saint-Germain, and who had TB. He cured, and he speaks very openly about that. Of course, not every single country is the same. From Stop TB, what we tried, we bring national celebrities that are open to speak about TB. So we have few of them here in Manila as well, including from Pakistan. So you are more than welcome to speak with them. Now, today you just heard, and I invite all of you to see, the minister is keen to take an X-ray, and the colleagues with the X-ray van are here. I will do one as well. Let's see if others are keen to do an X-ray outside. That shows that we should not be worried about doing the tests, but also what the results will be, right? And TB grew up as it was presented all the time as such a stigmatizing disease. But as I said, it should be very clear that it can affect each or any of us, right? So it should be zero worry or shame about it, but we cannot fight it without speaking about it. And here your role is crucial, because it's not enough that we feel it if we don't speak and share about it. And today in the opening, we had an amazing TB survivor from the Philippines that was very emotional in telling us his story. He produced emotions to all of us. But by all these people, and here you have some amazing group called TB People in Philippines that have amazing stories that can share and are speaking up to show to everyone, we went through this and look that we are now healthy and back to normal life and work. So there is no shame in having TB, but very good question. Thank you.
Okay, Dr. Reddy. So from Princess Castro of One Media Network.
I'm sorry, I think there's a follow-up.
Follow-up? Yes? Go ahead.
So our goal is to end TB. And what you can see the challenges that you are going to how are you going to combat these challenges just to achieve the goal? Sir Rojas, thank you.
Of course, the challenges continue to be information. When I was in school, they always said when you have an epidemic, it's the rumors spread faster than the virus. So if that's exactly our problem with TB. That's why there's stigma. And that's why we need the press conference, that's why we need to tell stories about tuberculosis. That's why we need to talk about the innovations. And we need to actually come together. I think that's the story we did. How did we fight COVID? It was partnership between the private sector, the government, the religious sector, national, local. I'm trying to generate that same snowball. Well, I call it a storm surge. So generate that same storm surge in the country, because in the country we have storm surges every time there's a typhoon. We're in a hotel that suffered from a storm surge after a strong typhoon. Now they built a wall to protect the hotel. But that's what I want. I want a storm surge of articles about TB, of people building us. The coalition against TB is helping us. The industry is helping us with diagnostics. This is the type of coalition or bayanihan. We have a Filipino word for it. The bayanihan to be able to end TB. And I'm sure we can be an example just like Cambodia, who got out of the list. At least I want to do that. That's one of my objectives and commitments to the president, to get out of that top 10 list. I'm going to get out of, I'm number 4 with the new cases. But if I get out of the top 10 list before I step down as Secretary of Health, I will be very, very happy. Many, many more Filipinos will be happy because that means they've been treated, diagnosed, and treated of tuberculosis.
Thank you so much, Secretary. So we're waiting for that next big wave, the next big wave. Yeah, because we all have beaches and the beautiful ocean. So we're waiting for that next big wave in innovations. And Princess Castro of One Media Network, could you please ask the question?
Good morning. Since you aim to spread awareness regarding the tuberculosis, are there any plans to collaborate with the education sector to educate and give awareness to students, especially for those hard-to-reach areas?
Thank you. That's a very good suggestion. Not only on TB, but on all other parts of health. We now have a unit in the the Department of Health called health promotion. Before it's prevention and disease control. Now we have a unit called health promotion. It's actually teaching young kids to be healthy, to exercise. And we are collaborating. I met with Vice President Sarah already to discuss many issues on adolescent health. And TB and HIV was one of those that we actually talked about, including many others like childhood pregnancy and nutrition and substance abuse and cigarette smoking and alcohol. So there is a lot of collaboration. We're ready to sign a curriculum, so we're passing some of our teaching curriculum and we'll pass it on from health promotion, pass it on to the teachers, that it can be spread to all the schools all over the Philippines. So that's a very good methodology and we're at it. So just wait for the results for that.
And Dr. Luchito would like to add?
I just want to add 2 points. One, very briefly saying that indeed children and young people will be an extremely important partner for this. And we used to have as chair of our board the Minister of Health of South Africa. And that was several years ago. And we were struggling in getting some attention. And he was saying, as chair of the Stop TV board, I need to really push forward the agenda. And then he was like, children. So we all didn't know where he was coming from. He was just saying children. Because if children are very clear that if you hear your adult coughing, a parent or somebody in the family might be TB, might be something else or nothing, they will tell, go and check. And he said, it's just that children need to know from TB side. And that's how he actually started saying, but once you go to school, you should not do just TB, exactly what you said. Go to school and you take. So they are extremely important partners for this. And then I wanted to say, you see, we have now these vans, like the one that is outside, where we will do the X-rays, as I said, that they are very important to go into the community. And then you can put in the van as well a gene expert, you can put something to test your blood pressure, you can do an electrocardiogram, you can take the weight of people, you can do for sugar. So you can do a set of tests, but it never works unless in that community there is awareness about what is it. So communication and as well mobilizing the school and letting them know that in these remote areas will come a van that will stay with you for 5 days, and the kids knowing they will always push and there will be lines outside waiting for it. So thank you.
It does look like an ice cream truck. I saw it outside. That might actually help. Right.
An ice cream. I think that would
Give the ice cream.
we should put an ice cream there. I think that's not a bad idea.
Hello. Thank you for that. All right, let's call on Ms. Catley from The Guardian for your question, please.
Thank you. I wanted to ask each of the ministers to assess progress towards the 2027 and perhaps what you think is the biggest potential threat to.
Perhaps we can start with your indulgence of Secretary Bosa, our minister from Cambodia, Doctor. Would you like to start? Yeah. Reach targets in 2027.
I think we have to start first with data epidemiology. I think so we should understand the magnitude of our problem in terms of the burden of disease based on scientific survey of what we suppose. Without knowing the magnitude of the problem, and sometimes you could not address the issue correctly done. For example, in terms of Cambodia, so far we have had 3 surveys, prevalence survey, 2002, 2011, and the third survey is ongoing. So we need to know our problem. Disease very specific. So wanting to be having a very evidence. So we would like know and understand. That's why Cambodia was to be out of the pandemic due to 2 casualty survey show big reduction is very reliable. So So we need to understand that, and then we did this. We need to also to understand to digest diagnose the problem of the program operation. For TV program, we need to know what has been the obstacle in terms of the availability of digital platform innovation I mentioned earlier. Although innovation, gene expression in the DOH quite long ago, more than 10 years now. But some countries, some places not yet have fully equipped with this. And some only with at some level. Like even in Cambodia, now we just quite recently we cover all districts with gene expression plus some other new platforms similar to gene expression. So we need to know that, and also another person is mentioned Panama Town, Israel. Israel very important. Israel, the problem with Israel is some country use Israel as a streaming pool. Honorable mentioned about the diagnosis. Streaming protocol, there are two functions in terms of Israel as a for your information. Due to my experience in TV ground for 20, I kind of small TV expert, medical expert. So in terms of X-ray, so some just use it as a so-called adjunct tool after everything. But to use it as screen tool like Honorable mentioned, very important. So from the start, screen it, screen by X-ray, and digital X-ray. So this we talk about innovation. So our question is we need to move faster toward innovation, toward technology, digitalize the system or whatever with some AI. We have the CAD system to help with the X-ray coming. So this is our so-called program big challenge. Missing case very important. Still we have 35 missing case. So we need to understand what where are the missing case in what segment of population, Catholic population, etc. In some comorbidity patient, like in patient, in diabetic patient, in congregate setting, I mentioned by Prime Minister from now that we need to reach the congregate setting like prison Congo. We have TB infection also. We have community, we have that, but we need to like say cover more, and sometimes it's kind of partial or superficial in effect. Although when we talking all these three or have the service, but they are not fully equipped, fully packaged in a full packaged manner, in a very so this is our programmatic challenge. Result challenge, I think the result everywhere, like Dr. mentioned, that we still face the result challenge, especially the financial result. Like I said, if you want to double the effort or triple the effort, at least we have need 1.5 increase of money. Although it's not proportionally double money, triple money, but I think we have some more. We need some more. So in this regard, I could end my talk by saying that we still have two group of challenge, namely the so-called programmatic challenge and also result challenge. And we need to address both together. Otherwise, if you just do one and forget the other, that's not. We have the idea, we have the policy, but have no result to implement. No human result to do it. That's not. Thank you.
Thank you so much. And how about in Lao PDR, Deputy Minister Favan? How far are we on the targets and how confident are we on achieving them, the targets for 2027?
Thank you for 2027 targets. So I agree with Dr. Mao, Dr. Teodoro, and Dr. Wisika, because we have a commitment, we have the same strategy to TB elimination. But the important, not only maybe in Asian country, but in the world. So the problem is we should think about the cheaper. For example, budgets of financing, human resource, strategy plans, and implementation. So this is very important, but another, we have to make more education with the people, because some country, we have different people, especially in a remote area. So for which the goal for me, I think I will give some check session. I think SDN Secretary may consider organizing an annual meeting. So we will monitoring and progress toward the 2027 to prepare for TB elimination by year 2030.
And may I invite remarks from Assistant Minister Hinoshita of Japan.
Thank you very much. I recognize that the goals by 2027 is a just goal, and on the other hand, we have to achieve SDG. I also recognize that the current situation is off track. We have to accelerate our efforts in order to achieve the SDG goal. But if we cannot achieve the goal by 2030, we have to continue to make every effort to achieve the NEP here at Kaizen.
Thanks so much, Secretary Orbota.
I'll simplify that, simple brain. So the way to do it is on three things. Number one is communications. That's very important. I value what you will write and how many people will be informed about tuberculosis and the targets through putting and all the efforts that all the other ministers have described. The second is coordination. I described about stockouts and about the diagnosis, about the plans of TB of all the countries. Implementing it operationally is the struggle, especially in an archipelago like the Philippines with 7,600 islands, remote villages. We call them GIDA, geographically isolated and disadvantaged areas, where even reaching them is only by a banca or climbing 2 or 3 mountains before you reach the people. So the ultra portable X-ray helps out, a portable gene expert or SD biosensor helps out. So the coordination of different agencies. So my program, we're talking to labor, social welfare, education, be able to implement and reach the targets of the dream. The last is really collaboration. And this is where my Philippine Coalition Against Tuberculosis comes in. The private sector, the specialists, the patients, the TB people, the people who are survivors or patients themselves. So we always have to include them in all the plans. I think if we're able to do all the things, communications, coordination, and collaboration, I think we can end with and reach the plan.
Thank you so much, Secretary Herbosa. And we're down to our last two sets of questions. First from Pam Castro of AFP.
Hello, good morning. I have two questions. First is for Secretary Herbosa. TB medications take a long time for patients. It requires many medicines. So, Secretary Herbosa, how do you think we can address the lack of compliance of patients in terms of completing their medications?
I'm glad to address compliance because of the long therapy, many patients on their own drop out. They drop out of the regimen. They feel better. So I don't need to go to the center and get medication. And this is also going to be corrected with information you will write. They need to complete therapy. So that's one, we need to get that education and information out that if you're put on therapy, you need to end and complete the whole course, even if you're symptom-free after the first month. Because many of them feel so much better after the first month, but that's when the problem starts because they don't return. So we have end up with drug-resistant TB. So that's the other thing. So we want to shorten this. There are the new innovations that shorten the therapy. We just launched a 4-month therapy. We're hoping that the other innovations will also come, and also the prevention through the vaccine. So I don't know. I think the key here is again communicating the fact that if you're on TB, if you're diagnosed with TB, you should complete therapy. And completing therapy eliminates the disease. Dropping out of regimen will just increase our multiple drug-resistant cases.
For Dr. Lushika, you've worked with many countries already to counter TB. Can you describe how grave is the TB situation in the Asia Pacific? And you've mentioned stigma, but apart from that, what are the challenges have you observed in the countries in Asia Pacific, specifically in addressing drug-resistant TB?
Very good questions that deserve a good answer, but also a lot of time. So I will try to be short, so I'm not exhausting all the points to this. So actually, when you look at TB is everywhere. So there is no country in the world that eliminated or ended TB, okay? It's a pandemic, but for political reasons, people don't necessarily want to say about it because they want to remain with the big pandemic, the COVID. But TB is a pandemic. The definition of pandemic is that it's in every country and it impacts the life of people. I'm saying that because then when you look at the globe, each region is different. For example, the African region has a lot of TB HIV co-infection and huge number of people with TB there because of the HIV, huge co-infection rates. Also, the systems there are not good. So you have big rates per 100,000. The numbers are not that high, but because countries like Lesotho and Eswatini, for example, are on top of those per 100,000 because they are not very big population, but a lot of people with TB. In what happens in Asia Pacific, though, are the big numbers, big populations, and therefore a lot of people with TB. So if you ask, to stop TB for a while, we focused a lot on Asia Pacific. We focused on India, Indonesia, Philippines, and other countries in the region. Just because if these countries are moving, the world will move because these are big populations. So that's why when we see the achievements in Philippines, in Indonesia, in India, and the push, we know that will drive the world because they will change the needle a lot. You can work a lot with a country with 7,000 people with TB, but in a population of 1 million, that's huge. But even if you do something with 7,000, for you, you don't care of 7,000. There are much bigger numbers. So there is a big burden in the region. Big numbers, a big reservoir with people with TB. And that's why what the minister said as the target that is achievable in his tenure for sure is let's try and find and diagnose those that are with clinical TB or subclinical TB. But let's find people that are in need of a diagnosis and treatment, let's achieve that. Because that doesn't necessarily mean that will impact the incidence, because incidence of a disease is about transmission in the population. It's too long to explain. But finding and treating everyone that needs the diagnosis and treatment is extremely important. So the burden in this region is high, as I said. So that's why we focus here. So the challenges that we have with TB are, I would say, I do like the minister, I also like very few things that are three, okay? One is political commitment. Again and again and again. Too few political leaders are aware about what affects their people in the countries, okay? And it's everywhere. I mean, even in Japan, even in South Korea, because I know we have colleagues from South Korea here. South Korea is a high burden, among the high burden country around the high income countries, okay? So, but very few leaders realize that. You will be shocked to hear not only even ministers of health, leave aside prime ministers, they have no clue. And I can name a few of them that are like, oh, from high burden. So the Minister of Health needs to know, okay, TB kills my people, how much? Because if it's not killing that much, you don't need to be. If it's not in the top, where you are not a high burden country and the TB is somewhere, cause of death in your country on the place 40, don't need to be that worried. But if it's in top 5, then you have an issue because it's airport. So first is political awareness, and that's why we are very pleased. Last year in September, we met and we had as well, we have an initiative called Coalition of Leaders, in which we push heads of states and governments to take ownership. Because we don't have too many heads of states and governments that speak about TB, but we have Prime Minister Modi of India. We have the President of Indonesia now, they had elections in the new one, and I hope the new one will continue, President Joko, the President of Philippines, the President Lula of Brazil, the President of South Africa, few presidents, Kenya and Tanzania, that are few presidents that take ownership and say, you know what, we have to deal with TV. So with this political commitment. The second one is, and that's a much bigger bottleneck than political commitment, is money. Money. With attention come money. And our frustration is the fact that even though, as I said, TB is a sort of COVID, okay? Or TB was here before COVID. When COVID came from Stop TB, we did a press conference. And we said three things. First, all the attention and money will go to COVID and TB will be a disaster. TB was the biggest infectious disease killer before COVID. What we said, COVID will come and go, TB will remain, and it's happening exactly now. And the third thing, we said that COVID will make TB much worse, and it's true because, you know. So, but for COVID, even though it's airborne and even the same, money were found very quickly, and the world got very mobilized. Why it's not the same for TB is a shame. Because it's, again, airborne, and God forbid any of us to get infected airborne with drug-resistant TB. It's a very horrible form of tuberculosis that we have. So the second big challenge that you ask is money. And because we can request the governments to put as much as it's possible, it's not easy because the budgets are limited. And then we need to look at innovative way of doing that. And it comes from private sector, high net worth individuals, but also smart investments. Like if you buy some equipment that serves not only TB, but like the X-ray that we speak about is not just TB. The AI can read cancer, can read other things. So invest in things that can be used for other diseases as well. And the third is the general awareness in the population, which is linked to the entire discussion. We had stigma and so on, and is linked to communication. People need to know, and people need to understand. It's not a shame, it's curable. And with that, it comes engagement of the civil society and communities. Very often we forget, very often we don't have enough TB survivors with us that not only to tell their stories, but to drive the entire movement. So from Stop TB, and I recognize here in the room our vice chair of the board, the Dr. Austin Obiefuna, who represents not only civil society, but all the people affected by TB. And that's why the third challenge is how do we really embrace and put them at the center. The last thing I want to make is very important. You see, it's very easy to diagnose and treat people like us. We know where to go, people like everyone in the room, right? You know where to go if you are sick. You are having some insurance, or if you have any symptom, you know what to do. The people that have a vulnerability, people that are living far away, that are very poor, maybe if they are a sex worker, or if they don't have papers, or if they are a migrant that moved around and is not in order, that maybe is ashamed or scared. To find them and diagnose and put them on treatment, it costs more and it requires a lot of efforts. It will not be done sitting in your office as a doctor and waiting for them to come, because they will not come. So that's why all the efforts that we do to come closer to the people, it will be, of course, it will lead to the desired outcome. So breaking these habits and way of doing business in which we reach a certain, like it's the same, we spoke about reaching the SDGs. You will see for every disease, we will go close to 100%, but reaching the people between 90 and 100% will be the help. Because it's very, the up to 90%, you kind of, when you have a tree with fruits, you take the ones that are lower. The ones in the top, you need to do an extra to find them. And that costs money and time. So I will stop here because I can speak till tomorrow.
Thanks so much, Dr. Rikshika. Yes, the mango fruits are easier to get when they're lower on the tree. And now we go to the last set of questions from JC Kotico of TV5.
Hi, Zach. I just have Hi, Zach. I have two questions, sir. Earlier you mentioned about the issue on logistics management. Just to be clear, how are you addressing this issue?
Of course, go to root cause analysis and find out why the meds we buy, because we have the budget. There's a TB program. We buy the meds. The meds arrive according to the contracts. But how come the patients go to a center and the health worker says the supplies have been delivered? So it's really more of not lack of supply, but actually the movement of the supplies to get to them. So I've actually met with one of the top consulting companies in logistics and supply chain management to actually help us and probably put this. I'm also trying to look at how, again, technology, digital technology for supply chain management and logistics management is going to happen. So, you know, in any problem, my field is emergencies and disasters. It's about moving the resources to the people that need them. So basically, if you want to fight TB and you want to test them, you have to get the testing to them. You want to treat them, you have to get the medicines. It's all about this, and it doesn't require a doctor. Sometimes the better experts here are the military, because the military, they know that if they're going to go to war, the logistics get there first before the soldiers. So they must have the ammunition ready. That's something we need to learn. In the health sector, we're weak at that. I think the soft drink company and the cigarette company are even better than us. So my solution will be non-medical. I'm going to talk with people who have expertise in making sure resources are delivered to the people that need them.
And Sec, just one last. Earlier you also mentioned about the increase in new cases, 2022 versus 2023. Is this alarming considering that TB remains to be one of the top 10 causes of death in the Philippines?
Correct. If you look at it, I did my own. It's not a scientific study, but I asked around. In 2020, we had COVID, right? Everybody was quarantined, being imposed quarantine. Everybody wore masks, KN95 masks, when they would go out. And there was no work, everybody was at home. If you can imagine that, when you go out, a barangay tanod will prevent you from going out without a mask, right? And if you consider that there was no work and there was no school, remember what happened? And you have a household, Filipino household, the low-income households have 4 families in one house. We had 1 person with TB. That's what we got. We tripled our TB before and after COVID. So that's what I have now. I have a tripling of TB. And I think it was transmission during that time in the household. The other one I'm thinking is that the TB, that one TB patient couldn't get out of his barangay. Why? Because we had lockdowns. And they went to a TB center that was not in their barangay. So obviously he couldn't get there because the barangay tanods in the other would block them. So they didn't get their TB medications. They also stopped. So the people with TB were transmitting. The people that were out, not in school and not in work, were living in a small household, and it's airborne. So we were protected against COVID. Our measures for COVID were 66,000 only that died in COVID. We're able to vaccinate 78 million. But the return is actually the triple increase in tuberculosis new cases.
So lockdowns have resulted today.
That's my theory. That's my theory, because you created a petri dish.
Yes, definitely. We reduced the transmission at workplace because obviously people were not working. There was not too much transmission in the public transportation, even though it was not the main. But people stayed at home, wherever home was. And I can tell you, it's not only that, what we observed and it was reported. People stayed longer before they went because they were afraid to go to the hospitals, that they will be. So people came with some advanced form of tuberculosis. We had doctors from a lot of countries saying we didn't see in a long time 16, 17 years old boys with cavity. It's very rare to have at that age a hole in your lung. Even now, it's a more and more rare. In the past, you cough, you see blood, traviata, and all this, dramatic TB. It's less and less hepatitis. Okay, we don't see that much because it means that you have a hole in your lung. So we see very advanced forms because of that. Yeah.
Of course. The increase, the tripling of TB cases is alarming. So, well, there are 2 things you have to remember. Before COVID, we started on a active case finding methodology. So when you look for something, you will find more. So that's something that happened also prior to COVID. We went out looking for active cases. That means if they had symptoms, we take their X-ray and we do a gene expert test. So we found more. But I think that's part of the factor. As we go on active case filing, we will find more. But that's a good thing. That means we can treat them. That means we know where they are. That means we can prevent other people from getting infected too. And we can prevent the other complications. Because not only does it cause cavitation in the lung, it can go to your brain with TB meningitis. It can go to your intestines with ileocecal TB, or it can go to your liver. So at least we can prevent them after pulmonary.
So much. So it is time to end TV, and the time is now 10 minutes to 1 p.m. And before we ask the secretary for the closing remarks, just closing remarks. So secretary, some closing remarks, please.
So my closing remarks is really, I said, communication is most important. So I will thank you all in advance for the stories you will write on tuberculosis. In the words of La Chica, whether good or bad, I thank you for those stories. I extend my gratitude to each and every one of you for your participation, very active participation, and we highlighted a very urgent need of our country, a public health problem of our country, and the global fight against tuberculosis. I am heartened by the commitment demonstrated by my colleagues, ministers from other countries, also alongside me and the Chica with Stop TB partnerships. And we will overcome these challenges posed by tuberculosis, and we will continue to reach that goal that we aspire for. We urge all stakeholders, and when I say stakeholders, kasama na kayo doon, you're all included. We hope we can make a difference in the millions of lives affected by this tuberculosis disease, and ultimately lead to healthier, more productive lives. So let us harness this enthusiasm today by today's discussion and intensify more our efforts. I think this is not the last story you will write on TV. I hope it will be the first of many you will write on TV, and I do hope that the final story will be a successful, happy ending story that TV is ended with this country and the rest of the world. Maraming salamat. Thank you.
Thank you so much for we invite our panelists to please join us for a photo opportunity to your right. To the right, please. That is the conclusion of our press conference. This is just a photo opportunity, but to my recall, 3 or 4 or 5 times we've been invited to the X-ray. Is that after lunch? Right after, right? Okay.